Hi, I'm Dr. Thomas Meyers. I'm a neuropsychologist that consults at Emerge Rehabilitation, and I'm just going to talk a little bit about what the role of a neuropsychologist is at a subacute rehabilitation facility. So briefly, what I do is I come in here as a consultant, and the role of a neuropsychologist in a subacute facility is typically to do a fairly brief assessment of a patient's current cognitive, emotional, and behavioral functioning. It's a fairly brief assessment. It's a little bit longer than what you'd expect in an acute facility, but it's shorter than the assessment that you do on an outpatient basis. It really just gives us a snapshot of where a person is functioning at in this particular moment. In a subacute setting, there's typically expectation that a person will continue to improve. So they're a bit of a moving target, and we just want to get a sense of where this person's at right now for a couple of reasons. One of which is to provide some direction about what a person needs at that time and what they could benefit from in terms of their, again, cognitive, emotional, and behavioral functioning. And two, it provides us with a means of tracking that person over time. So again, because we expect them to improve, we get a snapshot, we do tests that allow us to get an objective assessment of where they're functioning, and we can then see how they continue to improve over time and tailor our treatments to try to improve those areas that a person's having difficulty with. Whereas if somebody has intact functions in some areas, that's just as good to know as well. Also, there are implications for what type of facility a person would be best discharged to, and what kind of things they might need to follow up on when they leave, and also it addresses questions when indicated about what a person is capable of doing or maybe not recommended to do when they do get discharged. So briefly, that's the role of a neuropsychologist in a subacute rehabilitation facility.